The future of patient care delivery and modern work in healthcare is one where AI and humans intersect to scale expertise, transform how work gets done, and create better patient experiences. But it's not just about automation, large language models, and GPTs. It's about people, experiences, and the intersection of human empathy with AI. Leading this evolution is Teladoc Health and Microsoft, partners and innovators in creating superior hybrid care, virtual care, and telehealth experiences.
Hi, I'm Kim Swafford, Industry Executive at Microsoft and the Global Virtual Health Lead. I'm here today with Andy Pruderbaugh. Andy, nice to see you.
Yeah, nice to see you again.
We've been working together the past couple of years on a lot of different collaborations between Microsoft and Teladoc. And I kind of wanted to get a sense from you where you're seeing the future of virtual care.
Well, it's coming fast and furious. I guess the big answer is I think that it's coming quickly. There's a lot that's been going on, but fundamentally things haven't changed dramatically. I think if you look at the evolution of telehealth as an industry, it started out with being able to scale specialist care to locations that didn't have specialists. Through the pandemic, you saw it kind of emerge as the safe way to deliver care remotely because we had some unique constraints on us. And in today's world, I would say that we're addressing more of the operational challenges as a result of workflow shortages. And that's, across the board, there are lots of shortages. So it requires some new workflows, some change management. But the fundamental reason is you're trying to get care to the right person at the right time for the right reason. So, from that standpoint, I think we just have to remember we have to make the patient satisfied. We have to make it easy for the providers, and we have to be able to provide a return and reduce costs in healthcare overall.
That's great. And I think, you and I have both been in the virtual care space for decades. And I think, a lot of folks post-pandemic are seeing, maybe they're saying there's a decrease in virtual care, but I tend to think that it's actually just stitched into the fabric of the care delivery system. And so people aren't noticing it as much. Can you maybe kind of tell me what your perspective is on that?
Well, I would agree with you. That's a good way to describe it. It's stitched into, care delivery in general. And, there are just new tools, there's new models. And when you think about it, there's a lot of data being collected. And so when that data gets collected, privacy and security is important. It matters a lot. In fact, I was even yesterday alerted to the potential of what they call SIM swapping, which is where a cell phone gets hijacked, it tries to imitate the user and tries to get access to some of their private information. So, it's important that we evolve responsibly, and we have been. I think we've demonstrated through those eras that I've described the responsible delivery for delivering care at the right time for the right reasons. And now what you're seeing in this whole operational efficiency is that we're using the combination of, and I know you don't like the term hybrid. I debate it myself. I mean, it means different things to different people, but hybrid workflows might leverage off-site personnel with on-site personnel in order to do something uniquely better, more efficient, deliver better patient responsiveness and satisfaction, have people practicing more at the top of their license for the right task. So stitched in is the right, I think, perspective. It's just part of care delivery.
Right. And I think, too, in terms of that stitching, it's the data fabric that's really key to ensure that you can have that continuation of care across those different care settings. And that, like you were saying before, that clinicians are really working top of their license, right? And they're not spending a lot of time on the administrative burdens that we've placed on them, unfortunately, from a documentation perspective, correct? Would you agree?
Yeah, definitely. It's funny, I was listening to a blog the other day, and they were debating the ability to get more efficient so that providers could be more efficient. But the provider didn't necessarily have that same embrace on working harder. And so, we have to balance all of the things we're doing with people wanting to adopt it. We have to be able to think about how technology can be enabling for us. And I think about I think about it's great to be hyper-personalized, but if I bother you all day about something, you're probably either going to reject me or you're going to ignore me. And so we have to do it in the right motivation. I think about, predictive analytics that we can get out of, like you were saying, the capture of data. What can it do to help us understand trends? I think about natural language processing that we're doing together and the opportunity to be more productive, more efficient with the type of computer vision that's occurring in the room, the ambient listening that's occurring in the room. Those are all great things. Again, I'm emphasizing responsible and quite honestly, the technology that we're using has to be a bit invisible to the process because technology is not taking over the human touch. The human touch is being enabled by technology. And so the human interaction is important. And no matter what you have with technology, it requires human interpretation.
That's great. And I know, so you're kind of touching on AI, and everybody is using the term AI. And like it's a new term, and it's been around since the late 50s, right? So I think when we're talking about AI, what is your perspective? And you're just touching on a couple things in terms of computer vision, large language models, but you're also weaving in the theme of responsible AI. So I'd like to understand where you see AI and telemedicine.
Sure. So, I'll just say maybe a leading indicator for me was I started using your wonderful Copilot.
Yes.
And it's a great tool. I wasn't sure at first how it would help me, what it would do. There wasn't a lot of instruction, but as I began to use it and it was very intuitive, I began to realize it made me more efficient. And there were things that I could do, like, somebody sends you a stream of 15 emails and wants you to weigh in on it. You could summarize all those emails and be able to identify more productively, more quickly, what do I need to do? What's the action that I need to take? So I embrace technology. I definitely do. It's made my work life better. It's made things go a little faster. It does have a caveat that always says, please validate this information and make sure that it represents everything that you want it to be. But, at the end of the day, I think the most recent surveys are like 91% of hospitals are doing telehealth. They have a program in place, and that's up from the prior year by, 6-7%, something like that. And then when you look at the organizations that are actually providing telehealth, 80% of them are saying that telehealth can be equivalent to in-person care. That's pretty powerful. And so when you look at kind of the AI overlay to all of what's happening in telehealth, it is making it better. Just like I described Copilot, for a physician, there are things that make it better. For a patient, there are things that make it better. For a care team, there are things that make it better. And we all have to evolve in a very governed environment because, look, just like I gave you the example of the SIM swapping, AI can be causing hallucinations. It can do things that are not, not correct. And so, again, I'm just always going to come back to, you said it was here since the 60s. We've been doing, I think, 60 to 90 models that we're actually involved with in terms of the evolution of AI. We have about 10 models with you on the more recent conversation of generative AI. There's a lot going on, and I wish I could say that everything could just be solved. But it's going to create new problems for us. It's going to create the evolution of us to reevaluate how we're using it. There are great narrow applications for it. So I again, I'm just going to fall to the side of, I don't think a patient wants to be cared for by a machine. I think a patient wants to be cared for by a human. And whatever technology can do to enable that and make it better, we would embrace, but it has to be responsible.
So setting those guardrails in place is extremely important. And one of the projects that we collaborated with you on was creating some personalization. This was creating personalized outreach for diabetic patients. Do you want to talk a little bit about that in terms of, how we worked on that together and why we selected that particular population?
So I would give you the quick response, which is Teladoc is much broader than most people know. We have a hospital and health systems division. We've got a direct-to-consumer division. We sell to employers and we sell to health plans. And of course, one of the overarching challenges in healthcare is just when we face chronic conditions, and how can we help people to overcome those, manage those. And so when you think about, Teladoc does millions and millions of remote consultations. Teladoc does a lot of provider and patient matching using technology. Teladoc uses nudges from AI that will tell somebody, like I mentioned earlier, if we tell them they need to do something for their healthcare, that will go so far until they feel like it's doing too much or doing too little. So there's a balance to being actually intersecting the motivation of somebody. And when somebody is in a chronic care management program, they definitely want health, and they want to have the right information at the right time. They want to have access to the coach or the provider that might give them some information that could be helpful to them. So, when you think about those kind of scenarios, it's just kind of the low-hanging fruit that says this is one place to start, because we can't start everywhere. We have to kind of give ourselves the opportunity to validate the ROI hypothesis, the engagement hypothesis. We want to be able to do things that are helpful, but there is a closed loop feedback process that says, crawl, walk, run, and that's what we're doing.
That's great. Switching gears now back to the inpatient setting. I'm hearing a lot about virtual nursing and virtual sitting. Decades before, it was all about, looking at more emergent care, like telestroke, tele-ICU cases. And now we're getting more into this kind of broader care delivery model of, okay, how do we care for all inpatients leveraging virtual? Do you want to talk a little bit about what you're seeing in terms of virtual nursing?
So virtual nursing is a little bit of a title for me that I revamped to care team collaboration. Virtual nursing is because there's such a nursing shortage, and everybody was trying to figure out how to keep the patients safe in the hospital, provide the appropriate care, and follow them to the home. And telehealth is a great way to do that. It's scaling expertise at the bedside. So a nurse who might not have the same physical capabilities as they did earlier in their career, or a nurse that perhaps is in an area that can't travel, we can take advantage of remote workforce, just like we took advantage of specialists who were in metropolitan areas that would then serve rural areas. Well, if you think about that term of workflow transformation, and when I say hybrid workflow, it's kind of, again, it's bringing together a remote nurse as part of the care team with the on-site staffing, and having people do the things that they can do best and that they can do efficiently. So, as a member of the care team, a remote nurse, a virtual nursing program, can help admit the patient, work with the care team on the floor, can help the patient in terms of responsiveness to questions that come up, can work with nutritional consultations, can do things that don't take the on-site nurse away from other duties on the floor that definitely require the physical touch and the hands-on. And so there's opportunity here to really leverage the recruitment and the retention of nurses differently, because it's kind of creating new roles for nursing. It also is having an impact on quality measures positively. It's having an impact on NPS scores positively. It's having an impact on HCAP scores. It's reducing costs. So virtual nursing is a program about care team enablement. It just is kind of under that description of virtual nursing, but it really applies to any care team member that needs access to the patient. So I think that we have to look at virtual nursing as a broader solution for inpatient care, and it's part of the connected care platform that services the emergent side of the business, as well as the ambulatory side of the business, as well as all the way into the home, and then all the way across the ecosystem or continuum of care that we provide services to for consumers. So that's the power of coming together and being part of a platform that Microsoft is enabling for us. We are managing in a unique way for virtual care, and fits into what consumers are asking for convenience and access.
That's great. And I'm hearing the same results as I speak to my health system colleagues across the country and even internationally as well, that virtual nursing and this new care delivery model is really taking off. So I love that Teladoc is really invested in this space. The other thing too is maybe talking about virtual sitting and how you're leveraging AI to do virtual sitting. And maybe just to start off, level setting by talking about the definition of virtual sitting before we jump into the AI components.
Sure. And, virtual sitting is really about patient safety for somebody who might be at risk of whether they're agitated, whether their mental state is altered for whatever reason. We monitor those patients more proactively. And the observer capability through the virtual sitting solution that we offer does a few things. Number one, again, a human is attached to be able to interpret the movements, but AI can actually help identify if patients are becoming agitated, moving out of a safe zone in the bed, if they are moving toward the potential of a fall. So it's proactive in that nature. And I think, virtual sitting used to be a person physically sitting in the room watching somebody. Then it became kind of adopted by telehealth. Well, I'll do that remotely. And now AI is overlaying the capabilities to be able to do predictive analytics and say that patient is actually fine and safe, or they are moving into a zone of question that we need to monitor, or perhaps remind them with some verbal interaction, please stay in bed. I'll bring someone to help you. Those are the kind of things that virtual sitting capabilities do. So again, it's not just about the monitoring, it's about the capability of being proactive and helping look out for the welfare of the patient.
Yeah, that's great. It's also, too, I would say, you were talking about the one-to-one approach before, but it's also about scaling, the scarce resources that we have in the health system to have a one-to-many approach, right?
That's right. And telehealth was like that. It used to be a doctor would have to travel to a remote location to see patients. Now that was one to many, so they could be in one central hub and they could go to many different locations. And this goes right back to the principle. This is what telehealth was doing. It was scaling expertise. But to your point, who isn't talking about technology? Who isn't talking about generative AI? It's coming so fast, and we think that it's going to solve so many problems. And it will, but the comparative is the banking industry. It took 40 to 50 years for them to go from mainframe database kind of infrastructures to having online banking, to having portals, to now it's kind of like if you need personal banking, it's more the exception than the rule. Well, it's going to take the same kind of time to refine and be safe and responsible with the evolution of artificial intelligence. But it's not like, and you said it, it's not like it hasn't been here. We've been using it for a long time. It's just that the new buzz is more generative. And I asked Chat GPT, hey, how do I make $1 million? And it basically said, hey, work hard, or inherit it, or find something unique as an entrepreneur. So it doesn't give us the perfect answers. It gives us the directional answers that it knows about, but it doesn't even know me unless it has access to the information about me. So it doesn't know, the working class that I'm in. It doesn't know anything about my background, but it is helpful. I don't want to create a perception that I'm resisting it. I'm creating a perception that we're embracing it responsibly.
No, I love that. And I think, too, it speaks to the collaboration that we have, together and what we've been working on the past couple of years in regards to having that responsible approach to the collaboration and leveraging AI and generative AI in the right use cases. And I think that's been the true power of this collaboration, is bringing the great minds and powers together. So I think, I'm going to quickly glance, but maybe we should talk too about just the cultural shift, we in terms of adapting to virtual health. Going back to that a little bit more, we touched on earlier about, the pandemic and everybody jumped on virtual health, but what do you think that defining cultural shift is in an organization to truly adopt to a virtual health model all across, their health system?
I think, I come back to very simple things. For a care team member, it has to be easy to use. For the patient, it has to feel like you're concerned about me, and it's not just a sterile experience. That there is I've said it before, the human interaction that supports that. But for the customers that we're deploying to, it has to work in their technology infrastructure. And it has to work for them safely. It has to work for them from a security standpoint. It has to work for them from a scalability standpoint. And I think some of the things that we face are probably just the economics. Some of the incentives are not quite aligned yet, but they're moving in that direction. So there's more and more reimbursement for telehealth in general, certainly than there ever was before. But is there enough yet? Is there more to come? Those are things that we have to do more to align. And as that aligns, healthcare becomes a much more consumer generated experience. I'm going to own my own healthcare, and I'm going to do that whether I'm an employee and using Microsoft Office 365, and I have access to telehealth with Teladoc right there embedded into the Teams module, or is there something else that we can continue to do that makes it better, easier to adopt? And I'm of the opinion, especially in the hospital and health system segment, that the EMR is the record. It's the source of truth. I mean, it is the system of record for sure. And Teladoc is a system of engagement, and the collaboration tool offered by Microsoft. All three of those are so powerful to do so much. And by doing it together and complementing each other and not competing with each other, I think that's going to be more of a cultural shift than just, how it slowly evolves. I think it's going to be very transformational because technology, AI comes fast. And it's certainly not going to take the same amount of time as the banking industry, but that also means we got to deal with new problems that we might not have anticipated.
Yeah, I would say the consumer expectations are definitely increasing, as well as you were talking about the clinical workforce. The expectations in terms of how they do their work are definitely increasing. And the expectations is that you were saying, like, it's got to be seamless. I will tell you this quick story. So when I first started off in my telehealth journey about 20 years ago, I was doing an implementation for a tele-ICU program, and the clinicians were furious and about having cameras in the patient room. And now fast forward 20 years later, and I speak to nurses and they say, I want to have a virtual nursing program at my hospital. How do I implement something like that? And they're sharing best practices and how they work with remote care teams. It has just been a game changer overall in terms of how people are leveraging technology.
And isn't it funny that that was the opposition back then? And today we carry a camera around in our pocket. And I don't know if this camera's on or not. I just know that it's available to me. So I'm afraid, for what this might have seen or not seen. And this is why we have to be responsible with privacy and security, because these kind of things need to be governed. And healthcare, you don't get do-overs. Why are you excited about our relationship?
Well, I'm excited about the relationship because of all, like you said, all the various areas that Teladoc touches in terms of the care delivery system. And we can't keep doing things the same way. There, as we touched on, there are not enough clinicians. The consumer expectations are increasing. And so I see just this tremendous opportunity to scale the technology, to work with the great clinicians that you have, to really change, healthcare all up, collaborating with you all. So
well,
that's why I'm excited about it.
We very much appreciate the co-development work we're doing, which is very unique to the relationship. We appreciate the broad thinking, because I think we're not trying to solve small problems. We're trying to solve big problems. And sometimes, the small problems are somebody else's immediate focus, and we try to lean in on those as much as possible. But, I think helping to transform the industry to a better experience in general with the whole ecosystem of partners that we work with, including our hospital health system partners and our employers and our health plans. Those are stakeholders that have an opinion in how this works well or doesn't.
Exactly. So Andy, I get to speak with a lot of, clinicians and health system leaders across the globe. And, when I speak to them about Teladoc, they may have an understanding of one aspect of your business and really not quite fully understanding or realizing all the various areas that Teladoc touches. Do you want to just quickly go into that a little bit?
Well, sure. The hospital and health system segment, we have solutions for the emergent sector. We have solutions for the ambulatory sector. We have solutions for the inpatient sector. I mean, connected care is really what it's all about. We are connecting care not only inside of the hospital, but all the way to the home. And then while they're in the home, other parts of our business are already interacting with them in the home, and it might be about a chronic care program, might be about a follow-up call from the hospital or health system, or it might be that they're looking for an online virtual first encounter to determine whether or not they should go in and go somewhere else. So I think it's important to know that Teladoc is the culmination of many different segments coming together. Hospital and health systems, it was primarily that we would sell technology that would enable a hospital and health system to provide virtual care. Whereas in our other parts of the business, it's selling clinical services on the platform to be able to respond to consumerism. And when you think about where is the future is in how we all come together and work together. And this is why you hear me say things like, I know the importance of the EMR. We complement it. I know the importance of the collaboration tools and technology that Microsoft brings to their partners, and we complement it. And the value that we bring to virtual care experiences all the way across the care continuum. And we're all complementing one another. No one customer, no one company is going to solve everything. But there are customers who are saying, I need to solve more with fewer things because I don't want to be fragmented with information. I don't want to be fragmented with workflows. I don't want to be fragmented with support costs. I want something that I can scale much bigger and be part of a future ecosystem that is actually transformational for healthcare. That's where I think the power of our relationship lies.
I think so as well. I think it's bringing these platform companies together and giving our customers the building blocks that they need to establish the best program that fits their needs, right? Do you want to talk about where you see the future of the collaboration, if you can?
Yeah, well, so first of all, we very much appreciate the relationship with Microsoft. And I think Microsoft appreciates that Teladoc is the global leader in virtual care. And, together we do great things. You are in your wheelhouse and we are in ours with regard to clinical workflows. So we have an integrated platform. We're continuing to build on the infrastructure that Microsoft offers. So I think that's very positive in terms of the data and the advanced analytics that we're going to be able to continue to evolve. When you look at our distribution, as I mentioned before, we're in hospitals and health systems. We're working with health plans. We're working with employers. We're working in direct-to-consumer areas. And so we have a very, very good distribution. Our broad product portfolio is a combination of we have devices for healthcare that are purpose-built, and we also use consumer devices. We have the ability to add software and infrastructure, technology infrastructure as a managed service to be able to complement the EMR and to complement the capabilities of Microsoft that are being used by our hospital and health systems partners, by our employers, et cetera. So that's helpful in terms of not just the hardware, software, and services, but also the fact that we have chronic care, we have urgent, we have all sorts of other products that we offer that are leveraging the infrastructure that we have. And I would say, lastly, we are very mindful about bringing down the cost of healthcare. We're going at risk where we need to go at risk. We're working with our hospital and health system partners as part of a network. This is about having a return on the assumptions that we're making for the deployment of technology. And it's oftentimes soft and hard dollars, and we have to just really be specific about the value that we're delivering across the board and allow our customers to feel confident that that is a value proposition that works. And my last statement, Kim, would be, and we're not going to eliminate the human interaction that's required when we distribute the technology. That's the most important thing, because healthcare requires human touch to get well. We want that, but technology also enables the human touch to do more.
Right. I think we touched on this when we've met in the past, but we have a shared mission, I would say, about the empowerment. Microsoft's mission is to empower every person and every organization on the planet to achieve more. Yes. And Teladoc has a very similar mission. And so we don't want to lose sight of the personalization and the human touch. It's about that empowerment and enablement.
That's right. And our mission is empowering all people everywhere to live their healthiest lives by transforming the healthcare experience. What a great overlay that is.
I always like to quote, you can't keep doing things the same way and expect a different result. And I think the time is truly now in virtual health for these innovative care models to be recreated and also integrate with a human in the loop different AI models. And so I think this is why the collaboration with Teladoc is so meaningful. And I look forward to what we are doing next.
Here's what I believe, and I believe it to the core, and that is that human judgment and creativity will always be essential in interpreting AI-generated insights and informed decisions. There's a place for technology. There's a place for the human interaction. There's a complement to it. There's a balance to it. And I will always fall on the side of the human interaction will be more powerful when it is enabled by technology rather than technology alone driving without a human interaction.
In the rapidly evolving landscape of virtual healthcare, the integration of AI and new technologies must preserve the critical need for human interactions. Teladoc Health and Microsoft underscore the importance of a balanced and responsible approach, where AI enhances, rather than replaces, the human touch. The partnership between Teladoc and Microsoft aims to revolutionize healthcare experiences by leveraging AI responsibly and ensuring seamless integration with human-centric care models. Together, we are committed to advancing healthcare while prioritizing the enduring value of human connection.